So when you come out of surgery, you're going to have a clean, sterile, dry bandage on from the surgery center. It may look like this. It can be whether you have a breast surgery, a tummy tuck, liposuction. All of our bandages are sterile bandages to prevent infection. It may look just like this, white with no drainage on it. Just to show you beneath the bandage, what it looks like underneath is a sterile covered wound. You are never going to be looking at this. We do not want you to look at this, but just to show you what's there. This is a sterile bandage. Your nurse practitioner will take this off at your first week post-op visit. So we don't want you to take the bandages off. You don't have to do any dressing care. Just keep that top bandage on, covered like that, until you go back to see the nurse practitioner. This is your bandage. Occasionally we have some dried blood on the bandage, and this will dry up. We're not overly concerned with that. We don't want you to be overly concerned with that either. As long as it looks like this, it's still sterile, it's still preventing infection, it's a clean, dry bandage. The blood will dry up, so no need to worry about that. Sometimes when you come home from surgery, you may see drainage that looks like this. Sometimes a surgical wound will ooze some fluids or blood. This is not what we call an active bleeding situation. It's just some excess bleeding from after your surgery. So if you see your bandage look like this, I'm not very concerned about that. I just want you to reapply and reinforce some gauze over top of that. It will stop. You can take just some clean gauze from the pharmacy and some paper tape, and you're just going to put it right over top like that. That should stay nice and dry for you. Again, we're preventing infection by not taking off the bandage, but actually reinforcing it with more gauze. You might notice when you come home from surgery that you have a wet, bright red, bloody dressing. This is wet. We don't want it to stay next to your skin, but we also need you to call the office and let us know if your dressing looks like this. The nurse practitioner may have you do a dressing change. We will walk you through instructions on how to do this properly, but you can look at this video and see that you peel the surgical tape off very gently. You're going to remove that wet outer bandage only. Okay, and then so beneath there you have the sterile bandage that's keeping your wound free of bacteria, so do not take that part off. You're going to take about a 1/2 inch thickness of just some clean, fresh 4x4s, some gauze, and paper tape, and just put it right over top of the wound and secure it down just like that, and that'll keep it clean and dry, and we'll talk to you about your dressings.